Hello, good day. Hope you're fine. My name is Dr. Taiwo Shofoluwe. I work with Nem Health and I'm the head of operations. I'm here to discuss with you an illness or a condition. It's not an infectious condition, but the condition can be quite alarming. I'm sure you're beginning to wonder what condition could it be. I'll tell you, it's asthma. So what happens in asthma is a condition where the lungs and the airways in the lungs close up as a result of allergic reactions. So asthma is on the spectrum of hypersensitivity. So people who have allergies and things like that, they usually may have asthma attacks. So as a doctor, one of the things we ask when we are taking history for asthma is, do you have any family history of allergies? All right. So when somebody is, oh, I'm allergic to granules, I'm allergic to this or to that, then you might also have to ask questions around asthma. If you've seen somebody on asthma attack before, one of the things that happens is you can hear the person actually breathe. The breathing is something like this. That is one of the classic symptoms of asthma. Now, how can asthma happen? Asthma usually happens a lot when there's something that triggers the allergic reactions in the airway, things like dust. Animal fur and droppings of insects and cockroaches can, predispose somebody who is having asthma to have an attack. So, what do we do when there's an attack? Long and short, you need to go and get medical care, either at the hospital or visit a doctor or clinic or something close to you, so that they'll give you drugs to make the airways to expand. You have to make sure that the environment is as dust-free as possible. Thanks to the advent of COVID, we are no longer strangers with the face mask. So if you're going somewhere that is going to be dusty, please arm yourself with the face mask. Your home, make sure your home is as dust-free as possible. So if you're going to be doing your spring cleaning or, well, this is our environment, usual cleaning, make sure you do it regularly. If you are the asthmatic patient, you might not be able to do that by yourself. You might have to hire someone to do it for you or ask someone to do it for you, because there's a lot of dust in back. So I like going to the kitchen when my wife is cooking food. And what do? She's frying meat and I just go there, oh, what's happening? Well done, my dear. Give her a peck, and the next thing I pick a piece of meat. Yum. But because something is frying there going on, there's a lot of particles in the air. That kind of frying with oil particles and smoke in the air can also trigger an asthma attack. So you have, maybe you're cooking and you decide to use the old-fashioned way, instead of smoke in the place, in the area, and the child has asthma attack or this around there, and you're like, hey, it's related people. It is not related people though. Of course, sometimes you decide to deep fry palm oil or whatever, put palm oil on fire and want to bleach it, turn it from the red color to, making it look like vegetable oil. And while you're doing that, a lot of smoke in the air, the house can be full of smoke. So if you know that anyone or the family of asthma, I would ask you to refrain from those activities. So with that, Nem Health HMO, we want you to stay safe. We care about you and we need you alive out there. Stay safe, stay healthy. Nem Health.